So once again, looking at the sheep heart, look for the pulmonary trunk, the apex, this is the base, this is the right side. All right, pulmonary trunk comes from the right side of the heart, and we're going to go into the right side now. We're going to go through the back first, through the superior vena cava. The right side of the heart has the function of receiving deoxygenated blood, some extra light here, that has been circulating around the body. So it receives deoxygenated blood from the body and then is going to send it on to the lungs after it works its way through the two chambers on the right side. So this superior vena cava right here is going to bring deoxygenated blood or oxygen poor blood from the head and the arms. The inferior vena cava here is going to bring deoxygenated or oxygen poor blood back from the body. And then there's a third vessel. I can get this to show up nicely. The opening is back right in here. This is called the coronary sinus. And the coronary sinus is going to bring oxygen poor blood that has been circulating around the muscle of the heart. Because blood that is flowing through the heart can't diffuse oxygen and nutrients well enough into the muscle for it to be a good, what's the word I'm looking for it to be adequate, okay? So the heart has its own set of arteries and veins that feed the muscle. And we'll look at those later. So again, our superior vena cava, which has been cut here, this tube right here, and the inferior vena cava, this guy here, and the coronary sinus right here are all draining into the right atrium, which is, now I'm kind of looking from the bottom up. And the right atrium has also been cut. So it's this chamber in here. Okay, look that up a little bit closer. So this is the right atrium. Received blood from the superior vena cava, inferior vena cava, and coronary sinus. Now you notice that the right atrium has these ridges of muscle in the front, the anterior side. Those are called pectinate muscle. Looks like little bundles of muscle fibers here, okay? Pectinate muscle. The back of the atrium, the posterior part, has smooth surface. And the division between the two, which you can kind of see here, this little arch, is called the crista terminalis. All right. So pectinate muscle, and then crista terminalis. Now, once the blood has entered the right atrium, it's going to flow passively from the right atrium down into the right ventricle. So imagine this an intact chamber here. This is all fit together like this. We've cut it open. the blood is going to flow through a valve called the tricuspid valve. It has 3 flaps or cusps. There's one, there's another one here, and the third one kind of in here. A valve between the atrium and the ventricle is called an atrioventricular valve. Okay, atrioventricular valve. So this tricuspid 3-flap valve, which would have formed like a little cover over the opening between the 2 chambers, that tricuspid valve is an atrioventricular valve. Blood flows through here passively. There's a little bit of a contraction in the atrium, but for the most part, it's just going to flow through passively. When the ventricle is full and when the heart has finished going through its electrical cycle, which is another lesson, the muscle of the ventricle is going to contract. That's going to force blood up because, come back this way, the squeezing kind of goes from the bottom up to kind of squeeze the blood up through, well, where are we here? Through the pulmonary trunk and the aorta behind it. So we've got this squeezing action to push the blood up from the bottom. We don't want blood to go backwards from inside the ventricle back up into the atrium. That's not an efficient pump. So what happens is these little strings here that are holding on to the flaps of the valve are anchored to these sort of extensions of the muscle. So here's our little strings, and these are what people sometimes call heartstrings. The name of them is chordae tendineae. They're anchored to these sort of extensions of the muscle wall called papillary muscles. So when this contracts, so do the papillary muscles, and they pull just a little bit on these strings that are attached to the valve flaps, which keeps them from going backwards and allowing blood to flow from the ventricle up into the atrium. So they're an anchor system to prevent backflow of blood from the ventricle into the atrium. So again, these are the flaps of the tricuspid valve. These are the chordae tendineae. These are papillary muscle. And this is the right ventricle. So because the blood now can't go up through that valve it just came down through, the only way it can go is up through, let me see if I can get this to go. No, I guess I can come out through the front. The only way it can go is up through the pulmonary trunk. Okay? And that's going to carry blood to the lungs. Make sure my screen doesn't go blank again. So blood can't go backwards through the tricuspid valve. It can only go up through the pulmonary trunk to the lungs. There's a valve here too, called the pulmonary semilunar valve. So at the base of the pulmonary trunk, we have a flap here, and then another one kind of over here. This is hard to do with just one person. Over here on the side. So there's 2 little flaps here. They cup upwards so that blood can get pushed up past them into the pulmonary trunk. But when the pressure decreases because the contraction has stopped in the ventricles, the blood that's in the pulmonary trunk falls backwards against these flaps and closes that valve. So now we don't have blood going backwards into the ventricle. We want one-way flow of blood through the heart, always. Come back to the posterior side here. The ridges of muscle that you see inside the walls of the ventricle here is called trabeculae carneae. And then in the sheep heart is this structure that spans from the papillary muscles here over to the interventricular septum, the wall between the ventricles. So it goes across that ventricle there to the papillary muscles to help coordinate the beating or the contraction of the muscle. Okay, so it extends from the interventricular septum over to the papillary muscle. Humans don't have that in their hearts. Last thing I want to show you, I'm going to go back up to the right atrium. Think back to the ligamentum arteriosum, the little structure between the pulmonary trunk and the aorta that was a bypass in the fetal heart. Right here is something called the fossa ovalis. Okay? It's an oval depression. It is between the right atrium and the left atrium. In the fetal heart, this was a hole. This was an opening between the right atrium and the left atrium. Again, a bypass, because we don't need to get oxygenated blood going in the fetal heart. Mom's lungs are oxygenating the blood. So we can bypass going all the way through the heart to the lungs and back to the heart and out again. We can just bypass that and go straight to the left side of the heart. If that doesn't close off, shortly after birth, doctors can go in there, put a little mesh over that and close it off so that there isn't oxygen poor blood circulating around the body.